All right, well, we'll go ahead and get started. Good morning. Good morning. It is 9 a.m. We want to be prompt and be respectful of everyone's time. So welcome everyone to the school year 2022-2023 K through 12 COVID-19 testing program vendor webinar series. And this is our first one we're kicking off this week. And we're joined today with this first session by Goodside Health. So we thank you, both of you all, for being here this morning. This is in collaboration with Texas Education Agency and the Texas Department of State Health Services, also known as DSHS. And so here's how it's going to work. And then I'm going to turn it over to Goodside Health. They will present. While they're presenting, this entire webinar is being recorded for those who were not able to attend and for those who want to go back and revisit it. And the slide deck that they also will be presenting will also be posted. It'll be a link for you all to revisit, to print, and do what you need to do. So please just listen carefully. At the end, we will have a Q&A session. And then throughout this session, you can drop your questions in the Q&A feature, and myself and DSHS will respond as we can. With that said, I'm going to turn it over to either Mr. Pierce or Ms. Vega.
Thank you very much. Show my screen and so.
Yeah, thank you very much for the introduction. And as Cicely was saying, she's going to present and show the screen while I do the voiceover. So as soon as we get the PowerPoint pulled up, I can get started. But thank you, DSHS and TEA and all the districts around the state who have joined today. We definitely look forward to engaging with you and telling you a little bit more about what we can offer and how we're here to support everyone in the state of Texas to more safely reopen schools. So let's see, Cicely, are you able to pull up the PowerPoint?
Not just yet.
Okay.
It's disabled for me still.
Okay.
Let me go ahead and enable that. Sorry about that.
Thank you.
You should be good to go now.
Great. All right, let's see here.
Are you good?
Yeah.
Perfect.
Right.
All right. All right. Thanks, Cicely. So, I think it's helpful to get started with just a little bit about who we are at Goodside Health and why we're here to support districts across Texas and really, like I said, more safely reopen schools. A quick background on Goodside Health as a company. We started as and continue to be a multi-region pediatric provider with multiple different specialties that we serve across the state of Texas. Most importantly, our core business is really focused around K through 12 schools. And this actually very much predates COVID. So we have a program that we call School Med, which was built tailor-made for K through 12 schools, specifically here in Texas, with the backbone of that program really being telehealth. Again, before COVID ever hit, we were providing in-school telehealth, both physical and mental health, and complementing that with on-site rapid testing. So think of things like strep and flu and other rapid tests that existed before COVID, that predated COVID. And so through that time of building the program across Texas, we became very familiar with how to deliver testing in the K through 12 environment. Again, we used telehealth and the connectivity to our providers, our healthcare professionals across the state, and partnered with school nurses to increase access to healthcare. And so when COVID hit, it was a natural expansion for us. We already had partnerships across the state of Texas that, as you can see here, comprises really now in excess of 1,500 schools and over total enrollment of over 1 million children that we serve, students that we serve across Texas. So just to give you an idea of scope and experience there for Goodside Health, we really did build this program and build our team from the ground up and from the four walls of a K through 12 school out. As an example, we have 2 leadership team members on our team who are ex-directors of health services for major urban districts in Texas. So when I say we know EDU and we know health services in EDU, we really mean it. And we have other folks like Cicely and others on our team that came from the K through 12 environment and also know schools extremely well. So, we're extremely focused on delivering a partnership that works to meet the goals of our school districts across the state. And so as we think about why that's important for Dishes and this program, well, it really comes down to a few things in our mind. Customer service, if you can see it, we've highlighted there, extremely important. We believe that in order to meet the goals of our district partners, you have to be available, you have to be responsive, and we really pride ourselves in doing that. And so that's, as we got into the Dishes program, there was a need to help the state of Texas with COVID testing in K-12 environment. It was a natural expansion, and we were able to utilize what we had already built really across the state from an infrastructure and team perspective to deliver what we believe to be, really a best-in-class testing program. So why choose Goodside Health? I touched on a little bit of our company experience, but I'm going to hone in really quick on our COVID-specific testing experience. Again, I mentioned that our core business is focused in health services in K-12 in Texas, which means through the program that I just explained that we built, in order to deliver on our partnerships, we also had to scale a team of healthcare professionals across the state, many of which are nurses, some are ex-school nurses, and some are just nurses that may not be an ex-school nurse, but certainly very experienced in testing. And so before Dishes, before COVID, we'd already scaled that team and we had that infrastructure. So what does that allow us to do? Really allows us to deliver a turnkey solution. We do not need to leverage any third-party staffing partners to deliver on this program. And so when you have a need, you have a request, hours need to change, schedules need to change, which, as you guys have seen with many of the recent changes to the program, that will continue to happen, and it will continue to happen at a rapid pace. You've got to be able to adjust, and the introduction of a third-party staffing company certainly could provide a hurdle. We don't have that hurdle. It's something that we're able to handle in-house. And then from a technology perspective, we've actually built the entire technology platform around this program, which again, we already had a technology platform built for health services that incorporated rapid testing in schools. And so for us, again, it was just an expansion of existing technology. And so that allows it to be turnkey, super user-friendly. And again, if there are technology issues, we're not calling a third party. That's our proprietary technology, and we're able to fix it and make adjustments as needed to deliver on our partnerships. And then the last thing I'll mention is just we do have connectivity with and partnerships with some of the largest manufacturers of COVID tests, specifically rapid COVID tests in the nation, and we have since the beginning of COVID. So it allows us to really have inventory on demand and able to deploy it quickly. Just if you could go into the next slide, which, as you can see here, is just really a snapshot of those tests. And again, highlights a couple of those partnerships that we have and our ability to deliver a multitude of different tests. We have the ability to, again, be flexible with the district's needs, but also we've developed a program. We have very much, we have a great background on which tests work best in which environments. And so we're happy to also be consultative with our district partners and make sure that they understand all the pros and cons of each option. But here are the tests and the price breakdown of each. Again, I'll run through them quickly, but they're available online and probably easier to reference that way. But our Quidel Quick View test, which is probably the one we've seen to be used the most, it's $19 per test, and it's a minimum of a 25 test order. And on the Abbott Buy Next Now, same price. The minimum order is 40 tests in that box. Gen Body, $22 per test with a minimum of 25. And then we do also offer a secondary Quidel product, which is the Sophia. It does require an analyzer, and so it's a little bit different. And that analyzer comes with an additional cost of $1,200 per unit. And so this was actually one of the first tests that you saw available when COVID hit, which is why we have it on there. But as COVID testing has evolved, you've seen a gravitation a little bit more towards the Quick View Buy Next type test that don't require an analyzer. And then on the PCR side, I think you'll see from a number of the vendors, very similar tests. It's a TechPath combo. Ours is $105 per PCR test, and the minimum order is $150. So from a staffing perspective, a big part of this program is having the option to leverage staffing to conduct the testing, right? Our goal is really to take as much work off of the plate of our district partners as possible. And so staffing is obviously a big piece of that. If we're able to deploy our team members on site, it does allow us to allow school nurses and health services to stay focused on their population and on their kids, and not have to worry about this congregate testing program. And so with our staffing model, again, as you can see here, we actually can conduct the test for you, for the school districts, and that includes both the antigen test and then the collection of the PCR specimen. The staffing is $95 per staff member per hour, and we actually, just as a note, we have waived our minimum number of hours and a goal, again, with an attempt to reach the goals of our district partners. So we try our best to understand exactly what you're looking for and work within the changing confines and rules within the DSHS and TEA program, which I know many of you are aware of and may have some questions about as we move forward here. So Cicely, if you could go to the next slide here. So touching again on the technology, but honing in a little bit on the consenting process. So Goodside Health, we have built our own proprietary technology platform, as I mentioned. It's extremely user-friendly, and it doesn't really require any third-party applications, which again can come with additional customer service numbers that are not owned by the testing partner. That's not the case with us. We do not need third parties, and so because it's our own technology, we can actually run everything from the consenting to the resulting process through our technology, and it's built again to submit reporting as necessary and required by all necessary parties. So TEA, DSHS, CDC, et cetera. We will have all the necessary reporting capabilities within the technology platform itself. So here's a couple of screenshots as an example. Again, this is the patient registration page and probably good for reference. I won't bore you with all the fields there, but again, it's just an example of the technology we've built, how simplistic it is to use and user-friendly it is. But each individual needs to register and consent just one time. I think that's important. And the parents will, as it's mentioned here, the parents will consent on behalf of the minors and the students out there. And so on site, oftentimes when we have our own staffing, and even when we don't, we provide a QR code and can blow that up really big, so it's super easy to run through as many tests as we need to, as quickly as we need to, for that kind of in the field, on demand registration process, consenting and registration process. And again, here's a snapshot of the technology. This screen is actually to show you just an example of how the test and the students and patients are queued. So you can see there that it just, as they register and they sign up, you're able to, it populates immediately on the field for our testing facilitator, whether that's our staff or the district staff member. And again, somebody needs to register on site there if they have not already registered. You actually can register ahead of time as well, remotely with just a link. So it really depends on the plan and the goals of the district, but we accommodate both in the field on demand registration as well as ahead of time at home registration. And it's a really simple, easy search queue. If someone does register ahead of time, you just simply type their name in there and they'll populate within the system. Again, here's kind of the next phase of the technology platform. Just to get an idea of the workflow, you would go from the previous screen onto this screen. And once you've selected the patient, they will appear on this screen. And this is how you'll be able to, provide the test and eventually put in the results of the encounter. Which again here, just the next screen and the process here shows the breakdown of the test type, the outcome. Again, the results of the test can be logged directly in here, so that it can be appropriately and pretty automatically reported out afterwards. And then this is just the screen that the patients will get, that just show, once the results are there. So we do have the ability to send an email with the results. And so as part of the registration process, we'll obtain an email, and that way it's as touchless and seamless as possible patients and students and even staff members can be on their way after the end of the testing and know that they'll get an electronic result sent to them or their parent in the situation when there's a guardian. And then from a district perspective, we do have dashboards and capabilities for the district to analyze the data and see the data. Here's an example of a district dashboard. The district will, again, have access to this so that they can see and filter their data as they see fit. And it really just gives a good visual for number of tests done and some of the results and processes that have taken place. So from a required reporting perspective, when a district does partner with Goodside Health, we do take care of as much of the reporting as we possibly can. Again, it's a turnkey technology system that allows for minimum friction and really user-friendly experience, so that we can go through the test and let the reporting automate on the back end as much as possible. And something to note that I know a lot of districts have really had to communicate with TEA and DSHS about is the reporting piece is extremely important to remaining compliant on the district's side. So utilizing this technology platform, entering the results so that they can be reported appropriately is what will allow a district to maintain their status and eligibility to continue to order tests and have staffing on site. I know that we did see across the state, not specifically with our clients, but across the state, we did hear a lot about situations and issues where, because districts weren't reporting the data, ultimately DSHS and TEA had to put a halt to their ability to continue to order until such time that the necessary data was input. So I'm sure that you guys have received calls and emails and are very familiar with that. But it is extremely important that all of this information is logged into the system so that can be reported appropriately, and districts continue to have their capability to order the test, and they don't get put on hold until such time that they're caught up with their reporting. So we try to make that as easy as possible. So again, some of the program changes, we've just continued to iterate on the technology process pond, which is what we call our proprietary technology. We've continued to iterate on it so that it becomes more and more customized to our district's needs, and specifically to the TEA and DSHS program as a whole. So you'll see some improvements to the technology from last semester if you're a previous partner, or if you weren't, come join us, it's even better. And we've got a more seamless experience. I mentioned this earlier, but I'll point it out again since it's on the slide. We did remove our minimum number of staffing hours to come on site in an effort to really work within the new rule, or the rules of TEA and DSHS, so that we can fulfill our district partners' needs, which again, a lot of the time really requires flexibility on staffing. And so that's the reason we made that change. So partnership options, I think this is pretty similar for most vendors, but just at a high level, these are the two primary options. You can purchase just the test. And so we went over the testing options earlier, but if you wanted to just purchase test and have your own administration or staff self-administer and report and utilize the program without our staff, that's certainly an option. And in order to initiate that request, you would reach out to us at testing@goodsidehealth.com, and that will initiate the process. And we've got some questions that we ask that just kind of qualify exactly what you're looking for. But then at that point, we follow the TEA DSHS process here, and you're absolutely able to just order the test and not staffing. In that situation, again, we do have our technology platform. It's very user-friendly. We will support you and train you on those types of things to make sure that you're very ready to go day one, and ongoing you're supported. If you have questions or something arises in real time, we're here to support you. Even if you are self-administering and we don't have our staff in the field, we're readily available to help you and continue to make sure that you're trained appropriately. And then the second option is all of the same thing as the first, but it actually includes our own staffing. So this is when the district would request from us the ability for a full turnkey solution. So everything from testing supplies through staffing the program as a whole, and again, utilizing our technology. And in order to make that request, you would use the same email address, which is testing at goodsidehealth.com. Again, we are here. We know a lot of districts have funds that they have not tapped into, and they also have a lot on their plate as schools reopen here, with all the focus on school health and safety right now. We are hearing a lot of requests with regard to staffing and helping provide a turnkey solution so that districts can stay focused on safety and education, and making sure that they aren't skipping a beat, and that this congregate testing program doesn't pull bandwidth away from the existing district. So those are the two options, and it's kind of with and without staffing, basically. Again, how do you get started? Mentioned it a couple of times. The email address is testing@goodsidehealth.com. That's where you'll be provided a basic intake form and ask a few simple questions to make sure that we understand exactly what you would need. And then once you are ready to place an order, you would do it through that process once you have connectivity. And while we put materials and testing supplies can be mailed out within 2 to 3 business days, we have inventory ready to go. And honestly, as fast as we receive a fully complete intake form, and we know exactly what you're looking for, and we followed all the necessary steps within the DSHS TA process here, we would ship same day. And so it's 2 to 3 business days, but it really realistically can be quicker than that. Just want everybody to make sure they're aware of that. There's not a lag time. We're not having to order the test and then get them and then ship them. They're on site. We're able to ship them out immediately. And if we want Goodside Health staff to help our district with testing, how quickly can we start that? I mentioned this earlier, but we are unique in that we have a statewide scaled infrastructure that includes nurses and MAs and those that are available to provide this testing, to administer the testing. And so while we put 10 business days to be on site, this is really more of an experience of how we've seen the process shake out with our communication with districts and evaluating their needs and working towards building a plan and then eventually being on site. We can certainly do it faster. It just really comes down to getting to the bottom of what our district partners are wanting, and then we can deploy staff very quickly. Because again, we're not, in many cases, we're not having to go seek a third-party staffing company to find someone to make that connection to the district. We have those folks many times readily on demand and available to deploy into the field. So 10 business days, but again, sometimes it can be quicker than that. And those are really the only FAQs that we had outlined. Certainly, we would love to answer questions and engage with our district partners out there who are listening. One last time, if you are interested, if we did answer all of your questions and you would like to get started, I know that school's starting, depending on where you are in the state, it has already started or is starting today or very soon. And so we're here to help and be very responsive to those demands. Just shoot us an email if you are interested at testing@goodsidehealth.com, and we'd be happy to engage. And then the last thing I'll say, I've mentioned it earlier, but while we're very excited to support this program, we will be here after COVID. We are not here just for this program. We've built a program that serves K through 12 health services, and we'll be here long after this program and COVID has transformed into whatever it will transform into here. And so I say that because these partnerships matter to us, and we really want to support you guys during this time of need, and we want to support you in a way that makes sense for you, right? And whatever that may be. So for any reason you've got questions, you want to engage, please reach out. But we do very much value our partners, and we do like to have a long-standing partnership that really should outlive this program as it's expected to end at the end of this school year as it's currently contemplated. So please feel free to drop some questions in the comment. It looks like there may be a couple. Let me click on those.
Okay, and thank you so much, Cecily and Mr. Pierce. What's your first name again?
Kevin.
Kevin. Okay, I didn't want to say Mr. K. So
I go by that too.
Got you. So a couple of questions here, and also I said this at the beginning somewhat, but let me reiterate this here. I know there are other ancillary or adjacent topics. I want to make sure that we are specific with our questions towards Goodside. And so if you're referring to other vendors, we will answer that generally speaking, but just want to be careful there. So question, and this is a big one that's come up recently. With the recent updates to CDC guidance concerning asymptomatic testing, et cetera, any flexibility with the grant from TEA dishes for symptomatic exposure testing versus solely screening seems especially limiting for large districts that no longer aligns with CDC. Great question. So we've actually been answering this question individually. So as you understand, TEA is partnering with Dishes. Dishes is the direct recipient of this grant from the CDC. As of right now, the CDC has not issued official grant guidance updates. When those updates come and Dishes is informed and that's in writing, then when and if that comes, then our grant guidelines will then follow Dishes directives. But as of right now, the CDC has not released any official grant updates. And so we can only go by what's on paper right now. But as soon as we find out, we will let you know. And you're welcome, Mr. Gaddis. All right, Justin. All right. Any other questions for Goodside Health?
There's a question that looks to be in the kind of the answered portion of the comments.
Yeah.
I don't know if that was already okay. Yeah. Diane, you may have answered that. I'm sorry.
Yeah.
I'm slow.
Yeah. No worries. Go ahead, Diane.
So I was just going to address that Linda had asked if she has tests left over from other vendors, if Goodside Health could assist with that with their staff. And that conversation has to happen with DSHS and TEA before we push it forward to Goodside. There are circumstances of which we allow that, but we have to have a conversation first. So I provided Linda with my email address and Anika's, and then we can set up a call to discuss that. And of course, we'll invite TEA to that conversation. But
yeah, thank you, Diane. There was another question that just popped up that seems like it's. Do you want to read that, TEA? Sorry, I don't know if I'm supposed to read these or not.
It doesn't matter. We can flow. It's
okay. Well, I'll read it. It just says I received 75 tests, but this is not sufficient for the size of our district. How do I order more tests? And it's email Cicely ? So I can answer first, and then TEA if you want to follow up with more guideline specific. From our perspective, that is how you would place the order. You would order Cicely or testing at goodsidehealth.com and initiate the request. And I'll pause there and I'll let TEA or Dishes speak to the process because it seems to be kind of more directed at not a sufficient enough quantity for a large district, which I know we've heard that several times as well. So I'll pause and maybe let TEA answer that one.
Yeah, no problem. So I'm not sure what district this is, so I'm not sure if you've already been approved in the testing program. If you have been approved, and you said you received 75 tests, so what needs to happen is as soon as you report up to 80% of those 75 tests is used in the vendor portal, then we will have that, and then you will be given or allocated additional test or incremental test. Now, if there's some type of emergency or something like that, then there's a possibility where more could be given. But as of right now, 80% of those 75 tests would need to be reported as used in the vendor portal.
And
Diane, go ahead, Diane.
Yeah, I was just going to say, I would like to provide Sandra with a little bit additional information as to why it looks like they've only been given 75. First of all, I don't know, we don't have any idea what school district Sandra is with. But when the allocations were evaluated for this year, we looked at some at what happened last year and evaluated that most of the time, most of the school districts that tested last year only tested 2 to 3% of their entire staff and students. And so when we were evaluating how many tests that schools could get, that's what we used. We used that 2 to 3% from last year. So that's why it looks like you only get 75 tests. And, you know, if there's a burning need for something, then by all means, you can reach out to TEA and request a relook at it. But like Damon said, you get those 75 tests, and then once you report in the vendor's portal, and then the vendor sends us that information that 80% have been used, then you would show back up on the list to be able to order again.
Thank you. All right, so that one was answered. The next one, if we're using Goodside staffing, will the district have access to the technology platform as well?
Hi, Gabby. I can answer that. Yes, you guys will have a access to the district administrative dashboard. And then if the testing coordinator is also performing testing themselves, then you guys will have access to the dashboard to conduct testing. So if you're doing dual rows, you'll have access to both of those things. So the district gets the dashboard with the district-wide data, and each testing performer gets a login to the system to be able to conduct testing. And I'll send all of that stuff to you once we are getting close to your start date.
Thanks, Cicely.
Sure.
It
So
looks
that
like
was
there's another question here towards us. So it says, this is our first year trying to do Goodside Health. Welcome. Our previous district nurse had set this up last year, but we now have a new nurse. How and when do we get set up with the new staff, and when would we start? So what I would recommend is just connecting directly with Cicely ASAP, and we can make sure that we transition that over to your new nurse. Again, it's a very quick process. So if you reached out today, we would likely be able to get your new nurse all set up. And as far as when do we get started, we would need to, I don't know the exact district and all the details around it, but I imagine, again, if everything is in line, and what I mean by that is you're able to order tests through the program, like you've applied, you've been through the process, then it can happen very, very quickly here. So would need more information to give you specifics, but we move quickly, and I would just recommend reaching out directly to Cicely or at testing@goodsidehealth.com with your name and district, and we'll get back to you here this morning.
Yes, sir.
And then this one looks like it's
Diane, I think is.
yeah,
Yeah,
more for okay.
explaining that.
I just responded to that one. And I just wanted to clarify with everyone, all of the schools that are on this webinar, that the first thing that you have to do for this year is to apply for the program. And once you apply, along with your test plans and everything that's required for it, once it's reviewed by Texas Education Agency, you'll receive an email saying, congratulations, welcome, you've been, your application has been accepted, or you'll get a denial, and the denial will say why it's being denied. Either your test plan wasn't sufficient, or your inventory numbers don't match up. And if you've been accepted, then you'll see your school listed on the allocation sheet on the TEA website, and that listing will tell you how much you're authorized to order from a vendor, dollar amount from a vendor for tests. And so the vendors, before they fill an order from a school, they look at that amount and then determine how many tests can be sent to you. And so if your name is not on that allocation spreadsheet, then that either means you didn't apply or your application was denied. And if your application was denied due to inventory issues, then you can contact Anika and I, and we can help you work through those things in order to fix your inventory numbers. And keep in mind that schools that have tests left over from last year are eligible to use those tests, whether they have applied for the program for this year or whether they've been accepted for the program for this year. You're still eligible to use those tests. It's your staff that has to administer them, though. You can't ask vendor staff to administer them until you've been accepted into the program. And you'll still, wherever you got those tests from, you'll still have to record them in that vendor's portal. If you got them from Goodside, you'll still have to use Goodside's portal to record them. So Anika and I would be glad to help you with any questions that you have. And of course, TEA also.
On that note, do we expect there to be any, this is kind of a Diane TEA question, I guess. Do we expect there to be any updates on the thresholds? You know, we've seen a number of districts that are not necessarily our partners, but ones reaching out to us that are that don't have the necessary information to input from last semester into the reporting process, which puts them in this kind of frozen state. Do we expect there to be a resetting at any point in time, or a moving of the guidelines to allow for some of those districts to have a desire and a need for testing, but you know, had a misstep last semester?
So Anika and I are working with school districts in that particular situation. We have not run into, well, we've maybe run into one or two districts that we have to do something about. Most of them, it's they need to go back to the vendor that they worked with last year to have them get their information squared away and reported to us correctly. So Anika and I have been answering a lot of those questions. And so.
And one other quick question, is the ratio, I think it's 80% that has to be completed before processing a new order. Are those guidelines, are those part of the grant, similar to the CDC changes, right? The CDC has obviously made changes that seem to be a little inconsistent with the way the current structure is. Is that ratio also part of the grant? In other words, it's not something that is adjustable. It just is what it is because that's the way the grant's written. Am I understanding that correctly?
Yes, correct.
Okay.
I was on mute, sorry. Someone has their hand raised. Juanita Molina, so I'm gonna go ahead and you can go ahead and speak, Ms. Molina. You should be able to come off of mute. I'm not sure if you still wanted your hand raised, but you've definitely been promoted to be able to verbally state your question or comment. Okay.
Okay, we have received before some login passwords and how to log in to put in the test results. Do we use those same logins for this year testing?
Hi, Juanita. You can continue to use your logins now. I'll reach out to you today and we'll make plans to get you switched over to the platform for this year, but continue to use what you have so that you don't have a lag in testing. So you can keep running. We don't want you to have any downtime while we make the switch over, but I'll reach out to you today with that.
Okay, thank you.
Sure.
Thank you for that. Please continue to drop your questions in the Q&A feature. And then Cecily or Kevin, if you have anything else you want to add, feel free to do so.
I don't at this time, Cecily. I don't know if you have anything else. I think we've covered most of it and we're happy to stand by and answer any additional questions as well. But Cecily, did you want to add anything else?
Just to say that I know with the new school year and with changes and everything else, you know, going on with the grant, with the program and with school starting, it's confusing and can be confusing, especially if you had a staffing change over the summer. But Diane's team has been really helpful at putting pieces together and pointing people in the right direction. So if you reach out to me and I can't answer you, then I have no doubt that Diane will be able to point you in the direction you need to go so that you guys can get started for your district or get set up for the upcoming year. So if you're confused or don't know what step to take next, definitely reach out and we can all help point you in the right direction to get you up and testing.
Okay. Diane or Anika, did you want to add anything?
No, I don't. Thank you.
No, me either. Thank you, Damon.
We still have about 20 minutes left. I won't belabor the time, but I'll just add some more room for anyone who might have some more questions. And then if not, then we'll conclude, but I want to still make some space for any questions. Okay, well, we don't have anything further. Then I think we'll go ahead and conclude the webinar. But I wanted to make sure, because I know we won't be doing one of these again, I don't see with a foreseeable future. So while we have the time, we want to make sure that districts, public and private, are getting their questions answered. But Kevin and Cecily, thank you so much for all that you provided today. And just for your continued support. This program would not be what it is without our vendor partnership. So thank you all for all that you're doing and your team. Like I said, this session has been recorded and will be posted later this week, if not later today, but at least by the end of the week, along with the link to the slide deck that they shared. So thank you both. Thank you to all the school districts that have attended, and we'll be glad to continue to work with you.
Great, thank
All
you.
right.
Likewise. Thank you very
Bye.
much, everyone. You all have a great day.
Bye-bye.
And good luck with school.
Thank you. Bye.